morning, ladies and gentlemen, and thank you, organizers, for inviting me here to speak a little bit more. What did I do now? Long show. Now, I start from this, so it was not my speech yet. So, a little bit about my background is that, yeah, I am a chemist, physical chemist by education, and I do not know very much about physical chemistry anymore, but at least I'm speaking the same language with chemists and biochemists and so on. From physical chemistry, I then moved to R&D work. I became an expert in chromatography. When learning to know what is chromatography, I decided that I start to sell that, because selling chromatography, you make better salary than doing the chromatography itself. Then I went to a US-based company called Millipore or Waters. Waters was part of Millipore that time, and started to sell chromatography. And when you are in US company, you really learn to sell something. So I learned to sell myself, and I sold mine to Sitra, 87. Sitra was that time an organization which was mainly giving loans. So I don't know if you know the Finnish Tekes, very much similar to Finnish Tekes, what is that today. And since 87, when I moved to Sitra, we started to change the way how to make this. I came in and I said, how in the hell can you give loans with so low interest to companies where you have very big risks? And I started to raise the interest first. Then we moved to convertible loans, and later on to equity investments. This company, Bioscience here, is Sitra's first equity investment. It was a convertible loan. And the same company was listed on Nasdaq 99 with the name BioNX. So it's a biodegradable polymer business. Well, training with the state money, what is venture capital, running through almost all the Finnish diagnostic companies, selling the companies to US mainly, losing the board membership. So I learned what is this, and we did a lot of investment in venture capital funds abroad as also. Companies, Advent International, Atlas Ventures, and so on. So I was teaching myself what is this business. 92, I decided that I want to make a fund of my own. But you know, when you are working for a state-owned organization, everything is not moving that fast. Trying to convince the board and all the people, what is this? But 97, I succeeded together with my colleague to found a biofund. And we started only 2 people. We started with 35 million euros, and then we started to grow pretty fast. So 2001, we had already close to 200 million under management, euros. And we were doing investments in the beginning in our portfolio in Sitra. It was very easy because we already knew the companies. But later on we jumped out and started to make investments abroad, because Finland was more or less empty those days. So we didn't find good cases from Finland, so we had to go to Scandinavia and to Europe. I moved to Denmark 2001, and as a consequence of my moving is that I also sold Biofund to Denmark 2008. The plan was to build up a very strong banking group for life science investments. I realized already quite early that this 10 years closed-end fund system is not working in life science. The problem is that you have to sell the companies too early. When the value is starting to go up, you sell it, not when it is up. And this is the big problem for venture capital industry today. This is how I see that. So you need to build up something else, and the plan was, why I sold Biofund, it was a banking group. Plan was to make early stage, later stage, public funds, also loan debt systems and analyst power for this. My timing was not very successful because 2008, when I sold Biofund, the banking world did this. And my owner 1 year after that said that they cannot continue the process. And I said that then I have to start to cut the costs. And I made a good proposal for them. I start from myself. Then life was easy for me after that. I thought that I get retired. But having strong networks, you really do not get retired. So I was invited in several places. I was invited to be advisor for Meria Development, which is a very big French corporate house. In Meria Group, we have altogether 12,000 employees. Revenue is 1.7 billion euros. So you know we really have good power to help the companies to grow up. And then I have made my own investments in now 4 companies, having my main focus on point of care. Because when you get old, you have to focus on something. When you are young, you can do what you like. So I decided to focus on point of care. My history here, I'm not going to details on that, but at least I have seen something what is happening in this sector. What I'm going to tell today a little bit, I cannot go to very deep details because I only have 45 minutes. All the details would need 45 days. So I'm going to home care, which is one sector which I see is growing very fast and really profitable business for many companies. I'm going to home testing. You know pregnancy tests and all this kind of stuff. This is a sector where I see a very big growth. I'm going a little bit to mobile health. I understood that quite many of you are from IT side. And IT and mobile will play a very big role in the future in healthcare. This is how I see this. Point of care diagnostics, I go to some cases on that, and then near patient monitoring. Point of care, people normally, when we talk about point of care, we mean taking a blood sample, taking urine sample or something like that, analyzing that. But my definition for point of care is more or less, it can be also in vivo, using different sensors, how to measure how my heart is doing, do I have infections and so on. So, market dynamics. Not all of us know that in the next 15 years, 50% of the population of most of the countries is over 65 old. Really surprising. And 50% over 65. And then hopefully we have also children, which means that the working force is maybe 1/3 who are covering the costs of the old people. And this means that the pressure on healthcare costs, it is very hard today, but it's growing very fast. Regulatory reimbursement things. I see very big problem on this because if we want to get new technologies to the market, we should have a really effective system on this. USA, they have pretty good. It's FDA approval. So it's one unit which is giving the approval for the whole USA. Some changes between the states on the reimbursement. But if you try to go to regulatory authorities in Europe saying that I want to get regulatory approval for my product in Germany, many times you get that in Germany, in Finland you need another one, in Spain you need a third one, and so on. So, you know, very complicated system, which is really slowing the speed to get new products to the market. Home care, I think it's one of the solutions because hospital expenditures are growing very fast. So people have to be handled at home. That's one way to lower the costs. Not many do not really realize how important role the developing markets are playing on this. On the technology development and all the other stuff, China, India, Russia, and so on, you know, these are huge markets, and they don't have to do same mistakes what we have done. They can adopt new technologies immediately. So for us, we have the difficulty because our hospitals have a certain system. And when we bring in new technologies, we are fighting against the hospitals or the laboratories. In these developing countries, you do not have the old systems. So in principle, it's much easier to adapt the new technology for that. Then we have all kind of new technologies, new materials, cloud services, IT. These are very important. And of course, the self-diagnostic, the market is big. It's now over $13 billion US, and it's growing very fast. It's the fastest growing diagnostic sector. Some key figures just here to show how important is the healthcare. In USA, the total healthcare cost is 15% of the GDP. So it's really much. 2,500 billion US dollars. And 2019, the expectation is that it's 4,500. So almost doubling in this time. Finland, even Finland is big, 15 billion. Big enough market for any company to enter in, only Finland, if you have a good product for that. It's 3,000 per person annually. So we are really using a lot of money for that. The young people, they do not know this, but when you get older and older, then you start to realize that this is expensive. And then some figures about the aging of the people and so on. And in USA, they have made some calculations that healthcare costs for people who are over 55 years old are 3 to 5 times higher than for people under 55 years. So I think this is just showing the trend, what is going to happen with this aging of the people. Big shift in healthcare is needed, and I have been thinking myself why reimbursement is only valid for sick people. Because my personal opinion is that you should get some kind of support also when keeping people healthy, not only afterwards. And there must be some kind of change on this as well. If we look the home telehealth market, the potential on this sector is 15 billion in USA, and Europe 20 billion. So there is lot of possibilities for IT companies as well coming to healthcare sector. Telehealth growth is fast, cardiac telemetry is fast. You know, it's very good if you can control yourself at home and sending the message to professional doctors, and they are then saying what is wrong in your heart or something like that. It's very difficult to get into the market with a product which is saying this product is giving the diagnosis, because all the medical doctors are against that. So it will not fly. Future opportunities. Diabetes is growing very fast because obesity is growing very fast. Cancer is growing fast. One of the reasons is this aging people. You have to die on something. So if cardiac is okay, if diabetes is okay, and so on, in the final end you have cancer. That's how it works. And many other diseases. Infectious diseases, I'm going to one case study on that, but it's a growing problem because of this antibiotic resistance. Bacteria and virus in the future, we do not know, do we really have antibiotics which is working? And this is why we should do something on that sector. Then I have a big list of different technologies here. I'm not going into details on it, but if you want to just to get some more knowledge about this, I have another presentation which is on point-of-care diagnostics, and I can send some information to you on that. And then really the challenge, developing countries, fastest growing market. Sensitivity of different methods is very important, so that you can really do things in the right way. We have to do something for the regulatory hurdles. This is something we need to speed up the development from idea to product. And then, of course, this mobile internet world, which is changing very much our healthcare systems. This is just continuation. Diabetes market is now more than 9 billion US dollars, and it's growing all the time. So it's taking the blood sample from the finger. I don't know if that's the right way to do this. There is one person here also who knows that it's not the right way. You need non-invasive methods for this. But this is how they are doing this. But think if you have a kid 6 years old, 10 times a day taking a blood sample from the finger. It's not nice. Maybe the first day is okay, but after 365 days, where to put the needle, that's the point. Cardiac, I have a dream myself that one day I have a system at home which is working in a way that I can check myself if I should go to doctor or take some medication for that. It's possible with the existing technologies. Infectious diseases, as I said, very strongly growing market. Cancer, all these markets are very big. So healthcare, if you look, mobile industry is very small market compared to healthcare. And a lot of other things, pregnancy, fertility, that's maybe the most stagnating market at the moment, not growing very fast. So if I would develop a product, I would never go to that market, because you really do not get good price of the product. Drug abuse, need for new things. And total point-of-care market, as I said, it's 1/3 of the in vitro diagnostic market, and the fastest growing. Normally, when you are looking at the growth figures, it's 2-digit numbers, which means over 10%. Somewhere between 10 and 20% is the growth. I give you one case here. This is a company in Finland. Respiratory infections. So if you look respiratory infections, in the Western world, every person is going half times a year to doctor to check if I have this problem. And what is happening when you go to doctor, the doctor is looking what are the best symptoms on this, and then he's making the best guess. I give you this antibiotic. No test results, nothing. He may take samples and you get the test results in 2-3 days. But before that you have already started your antibiotic treatment. This is one thing which is really causing antibiotic resistance, making the diagnostic mistakes. So there is a real need on this, and when I look the potential for only respiratory infections and point-of-care diagnostic on that, the total potential is about $5 billion. What Agdia has done, they can do 10 viruses at the moment, for respiratory, 2 for pharyn. And they are doing this with very simple method. So, you know, today if you go and they take the sample, they send the sample to the hospital laboratory where they normally are using PCR methods to detect what you can do on this. What Agdia has done is that they have brought the instrument closer to patient, not yet to home, unfortunately. That would be really something. But the process how this works is you have the patient, you take the swab sample from the nose or from the throat. After this, you put the swab in a tube and add the buffer. Mix this very fast, and after you have mixed, you put the tube in the machine. And then you wait 20 minutes. And normally patients, they do have this 20 minutes time to wait. And then you know what is my virus, if I do have anything. Very fast, very easy, no waiting times. And good sensitivity. We are very close to PCR sensitivities on this technology. And sales is really growing in this company fast. If there is somebody here in the group who wants to sell this in Estonia, feel free to contact me. I'm not the salesman for this company, I'm only the board member. Then if we look at the market trends on in vivo side, cardiac telemetry, all stuff, you know, we already have systems which are following how your heart is working at home. And information is sent via internet or via mobile phones, whatever you like to do on that. Ophthalmology, we have systems where the measurement is done by the optics. No need to wait the time to meet the doctor. Neuropathies, the same thing. Normally when you go to neuropathies, you have to wait the neurologist who is doing the EMG test for you. And in Finland, I know only carpal tunnel syndrome, you have to wait in Turku 6 months, in Helsinki area 2 months. And all the time this problem is getting worse and worse. So sleeping apnea can be done 24 hours control at home, sending the information via internet. And even air infections for children can be measured at home with USB stick connectivity on that. I have some cases here I will describe very shortly what I mean with these. As I said, that there are many alternatives for the technologies. ECG for heart, EMG for neuropathies and so on. Long list of these. And what is good on this sector is that it looks that all these technologies are getting closer and closer to patient. Of course, some of these technologies, we get bigger instruments increasing the sensitivity and like ultrasonic and so on. But many of the technologies are getting smaller and smaller all the time, which means that you can use them in the future at home or at least used by nurses. I said a few words about carpal tunnel syndrome. A company called Mediracer has developed a system for this. You know, the problem, as I said, is long waiting times in any country. Prevalence is 3 to 5% of the population. And normally when you have serious carpal tunnel syndrome, you do not work. So you are on sick leave, which is a big problem for companies where you see this. Diagnosis is very good method is this EMG. But the problem is that EMG is very complicated instrument. And normally the measurement is done by neurophysiologists. And at least Finland, we do not have enough neurophysiologists. We have to wait months in order to get the diagnosis, the final diagnosis for this. One neurophysiologist who has been in this business in the past also, he made an innovation how this can be done much easier. And this is a very small instrument measuring the electric signal between finger and arm. And you use 2 fingers. And when you measure the signal, then you really can understand from that signal, from the results, yes, this is carpal tunnel syndrome, this is mild carpal tunnel syndrome, or this is serious carpal tunnel syndrome. This measurement can be done by nurse. Even I can do this measurement. But the whole system is connected with Bluetooth to internet. And the results, they look like this. This here is just showing that this is okay, because the time from finger to finger is the same. But this one is showing that there is something wrong with the nerve. And very easy to interpret it. But normally neurophysiologists, they want to make this themselves. But now it's very easy because nurse is doing the measurement, sending this via internet, and the neurophysiologist is just picking, I want to give the report on this. It's very, very fast way to do this. And you get the results without quiz really fast, the same day when you go to your nurse. And everything is on cloud service, all the results. Very secret, of course, and so on. That's very important also when you are doing this. You do not transfer patient data, only the signals. Another case, I said infections in the air can be measured. Here you send acoustic waves to the air, and the technology is reading the echo which is coming back. And there are algorithms which are developed for this method, which are saying that yes, now it's an infection, or now it's not infection. This can be connected to USB in your computer. Then you see the results in the computer yourself. But for interpretation, the software recommends you to send the results to the doctor. And doctor is then reading the results from the computer, saying, sleep overnight, measure tomorrow morning again, and if this is still positive, come here. So no need to go if you do not have anything. Similar technologies for coronary artery disease, which is very serious problem in the world. 20% of us are dying on this. And a system which is just listening how the blood is circulating in the vessels. It's not very easy to listen this, because heart is having 100 times harder noise. So you have to measure very small noises. But this can also be done by using the right electronic systems. Then, what is needed? I'm just looking if I need time, but I can make this in time. So, sampling. Well, first of all, whatever you do on point of care side, you have to get same results what they get on the laboratories or in hospitals. So you just cannot go there and say that this is 50% of the performance of your laboratory test and so on. Nobody will accept that. Regulatory is a problem then. But meet the same specs what you have in lab. This is important, and this can be done with today's technologies. Sampling must be easy. When we are starting to do this at home, or nurse is doing this, it must be very simple way how to make the test. Speed is very important. Normal waiting time, 5 to 15 minutes is great. 5 is better, of course, because then you really can make everything fast. Easy test routine. This is important because there should be some kind of system which is checking that the test result is correct. So the interpretation of the test is very important in that respect. And cost. when you are going to point-of-care diagnostics, cost is the key for this. This is why most of the lateral flow tests are coming from India or China these days. Or at least they are trying to come. The problem is that validation has been very difficult. I have some cooperation partners in India and asking from them how many Indian tests are sold in Western world, and they are saying this much. So it's because of the validation. Maybe protection also, I don't know. Multiplexing will be the key, as you saw in the infectious disease thing. There are tests where you can make one virus, but if you can make all the viruses in the same test, it's very important. Which means multiplexing in several ways. And again, connectivity to data systems. This will be a big opportunity, especially for IT people, to start to understand what is healthcare and what are the needs on that. But also you need to understand the regulatory pathways from that. If we just look the in vitro business, there are big players on the sector already. Roche Diagnostics, Alere, Siemens. Those are the biggest ones on this. So it's very difficult to enter that market without good partner. And should we enter the market ourselves? That's a good question, because there are so many marketing houses who can do that and who can help on that. But of course, they are taking big part of your profits. Total in vitro diagnostic market is $40 billion, and there are a lot of acquisitions going on this sector. The only thing is, which is mainly for entrepreneurs, is that if you look the in vitro diagnostic business, most of the acquisitions are acquiring businesses, not technologies, which is bringing me back to the first idea what I had here, 10 years closed-end fund. So you have to sell the technology, but you cannot sell the business. You do not have enough time for that. And this is why the funds have to be very long-term funds when doing these things, to grow up the sales also. Many others. These are the in vitro players. Some of these are also in Finland. GE is in Finland. Thermo Fisher is very strong in Finland. PerkinElmer is very strong in Finland. So we know pretty well what is happening. But Nordic countries have been very strong on this sector. And this is why we have a lot of people who understand what to be done on this. The only problem what I see here is I'm one of the reasons for this, because I have sold so many companies to USA, is that when you sell the companies to USA, the problem is how to find marketing people after that from Finland. Because all the marketing operations, they will be transferred first to USA. So you find very good marketing people from USA, but how to get them to Finland? Husbands and wives may be good idea, but I don't know too many others. And the same in vivo. Philips, Siemens, GE, these are really big companies. And they are growing with these technologies, what they have, and they are coming also closer to patient. So really huge actors. The good thing in vivo business is that in vivo business I see acquisitions also where they are acquiring technologies, not only businesses. So there is a difference in vitro and in vivo business. And market size again, $50 billion. Should be big enough. And in the end, I would say that this is a very good list when you are planning to enter the business. Make these questions to yourself and try to find the right answers. What is the most promising healthcare sector? I do not know myself. I have some ideas, but I do not know. what are the key factors influencing to success? What you really need to look on this. Where to focus first? This is very important because some people, they are planning to win the whole market first and after that make the product. And what are the skills needed in these companies? It's not only the technology. You need to really to understand the market and the competitors. I'm a former salesman, and I say that the most important in business is to understand why you are better than your competitor. And even more important is to make your customer to understand that. Because it's not enough if you understand. Your customers, they should understand this. And this is really something you really need to make good analysis of the competitors when you enter the business. How to enter the market? You don't have to win the whole world. It's enough if you win few countries. And then you are a threat to competitors and they are coming and they want to buy you out. This is how it works. So you don't have to use 50 million to win the market. Use 5 million and win 3 countries. That's enough. Where you should be located, this is also very important. I would say maybe USA is the best place, but because they have the home market which is big enough. But we are not in USA. We are here in the dark north, and we have to be competitive also from here and try really to enter the right way to the right market. And then how to finance my great idea. And I think today this is the biggest problem. Not only in Estonia, but in the Nordic, in Europe. The venture capital world is getting down all the time. And that's because of the performance of these 10 years closed-end funds. So something has to be changed on that. Governments are playing very important role, and EU is playing very important role. We have to find a way how to support good startups. And then how to find the right partners. This is also, you really need good networks for this. But the most important is to start smart. So thank you, and if you have any questions, I'm available for that now and later.
Thank you for a very nice presentation, and you were much quicker than you planned for, so we have plenty of time for questions. Does anybody want to start? I see eager faces. I know some of your people, some of your backgrounds, I know you would like to ask. Yeah, please.
Thank you for the excellent presentation, Seppo. I would like to ask on the other side of the coin. What about the investors? Everybody knows it's research and development, it's a long path. And okay, there can be really success stories, and no, I think everybody here agrees with you. The great future can be behind these ideas. How would you encourage the investors to put your money in? Go and see the new technology. Don't be afraid.
Well, what I have been trying to do is to ask the investors, would you like to invest in hedge funds? Nobody wants to do that. Would you like to invest in real estate? Nobody wants to do that. And you know, make the questions, and in the final end, you notice that venture capital, by the way, is a very good tool. so because they are losing in every place now, or they have been losing in every place. So my personal opinion is that venture capital in a new model might be a really good opportunity. But change the model a little bit. That's important. Pension funds, I would say, I don't like at all seeing Finnish pension funds investing in US hedge funds. Because pension money should create something on the home market also. And I think one of the reasons why they are investing away is the regulation, the legislation, which is done for pension funds to minimize the risks. But I think they should be able to take bigger risk on home market. Because I'm paying the pension fee to the pension funds. And they are then pushing that to some hedge funds in US. And just a very good example, one of our investment committee members, which is sitting on very high level in one of the biggest pension funds in Finland. He was sitting on our meeting. We had 200 million under management. We were handling one thing, some millions case. And then he got the message on SMS. Oh, you know what? I have just lost much more than your money under management in one fund in USA. So 200 million is not really much for them. And this is what I would like to see, using the pension money to create something in your own country. But what to do for them? It's we should find one very good pension fund who is saying that this is a good thing to do, and the others they are following. This is what is happening on that sector.
Thank you for a very good question. So, next one, please. I'm sure you want to know how it's done. Yes, please. And use a microphone.
Indrek Kask is my name, and I am a biotechnology entrepreneur. Nowadays more into health tech IT, but I'm also closely following the mobile tech arena. So one question regarding that field, namely, you showed very nice case studies as for the mobile technologies, like for the ear infections and so on. So I was wondering, when you build your marketing campaigns, are you targeting doctors first, and they will push the technologies to the patients, or is it vice versa, that patients are asking for new clever ways how to monitor themselves, and then they're asking doctors?
Depends on the cases. In this infectious disease side, we know already now that the patients are starting to ask. I don't want to come to you to hear your guess. I want to get the test results. So you have to do that also. But you have to show also to the clinics that they can make money with this. Because healthcare is, all in healthcare is how to make money. It's also the big pharma, how I see this. The most important is not the health of the human beings, it's the health of the company. and health of clinics and so on. So you have to approach them in different ways, and then you can make it to happen. So not only patients, but also the clinics. Everybody must benefit out of this. That's the key. That's why it's very expensive to go all over the world. So we have chosen Finland now, we are in Sweden, and we are going to Germany. And that's enough. When we are good in these countries, then somebody is coming and saying, I want to buy you. This is how it works.
Okay, thank you.
Yeah.
I don't know very much about business, but it's sort of interesting to me that you want to sell your company when it is profitable in let's say 3 countries. Can you explain why you have to sell it if it is?
In order, you know, I don't want to sell, and nobody in this company wants to sell that because we do not have venture capital money. It's a family-owned thing, and we are just asking the question: what should we acquire? So we are looking what to buy to this company, but. I also know that if we are very successful on this, then we have maybe Biomeria, maybe Roche, maybe somebody else who is coming and saying, I want to buy you, I give you 200 million. So then the question is, shall I answer no thanks? That's the point. So I don't want to sell. And I think there is a very big difference if you look these partner financed and private people, private families financed companies, when we go and start the business, we are starting to talk how to grow, how to make this profitable, what to acquire in order to make this to fly. Nobody's talking about exit. When you take a venture capitalist in, I know this pretty well because I have been 20 years in this business. The first board meeting, we start to screen whom to sell. So it's a difference. Because we have this 10 years time.
Okay, thank you.
Thanks.
More questions, please. Yes?
Hello, my name is Evelyn and I'm coming from product development and engineering company 1012 here in Tallinn. And my question actually is that how big importance is the design, the usability of those devices which are used at home?
I don't know if design is that important, but design is important when you are looking the manufacturing costs, because that's influencing very often on that. Design itself, you know, people are not.
I didn't mean design, but let's say aesthetical, how it looks like, aesthetical appearance.
Okay, yeah. Of course, it should look like an instrument which you can use. And you can trust on the results. So if I have an instrument like this, Nokia, it's okay. But if I would come to the market with this Star Wars instrument, it would not sell anymore because people do not trust that this will fly. I think that's important meaning. But all these designs and these things, the manufacturing will be the key for the future. This is why I have invested in one company which is focusing. We are bringing the electronic manufacturing to diagnostic sector. Because manufacturing Nokia mobile phone is much more complicated than manufacturing a diagnostic test. And diagnostic test is done by hand. While Nokia mobile phone, the first one who sees my mobile phone is the one who is packing that. So there is a big difference. And this is why this automation will come to the market.
Thank you. Next question. Yes, let's wait for a microphone.
Thank you. My name is Harri Hallila. I'm a Finnish entrepreneur, also for the other audience.
Yeah.
You said that the Finnish pension funds are investing a lot to US hedge funds, but can you find any reason that why the US investor companies would invest in Finnish startups or Estonian startups?
It's very difficult. Business angels you can get, but venture capital companies, you know, here when we look at the US market and Finnish or Estonian market, in USA they easily invest 20 million in one quite early stage development company which is doing the point of care or something like that. The reason is that this company in USA, how they build the company, they have in very early stage they have 30 people working for the company. They have a board which is full of professionals coming from the sector. Alere, former CEO, Ross, former CEO, and so on. And you know, then we in Finland or Estonia, we are coming and asking, we want to get, we will win the market. We have a very good point of care technology. We have 5 people working for this company, and we only need 2 million from you. So do they really trust that with 2 million you can make something when they are looking the other companies in US using 20 million for similar purposes? This is a big difference. So, and we do not have these Ross and other top-level guys on the board. We have some scientists and some maybe business people on that. But there is a very big difference between USA and Nordic countries. However, they have invested in some of the companies, so somehow you can do that.
Okay, thank you. I think it was very, very excellent question, and unfortunately we don't have a very good answer on that, because the question would be how to attract more money into this region.
But by the way, there is another big problem what we are facing in Finland now, and Estonia also facing, because these US investors, in order to invest in these countries, they need a local lead, professional lead. And we in Biofund, we got the position that we are professional lead. So they were very happy to invest together with us. But now the biggest fund in Finland investing in life science is 25 million. And no real history on this. So can this be a lead for a fund from USA which has 1 billion? I don't believe that. However, I have seen also US investors in Estonia, E.G. for example. Ned Olivier, my old colleague, so invested in that. So it's possible, but business angels mainly.
Okay. Next question. I wanted to maybe elaborate more on the Indrek's question about the involvement of doctors, because from my experience, you can create nice devices and you can upload a lot of data, but the problem is that doctors don't get paid to look at this data because of a regulation. Regulation says that you only get paid when you see the patient. So how do you see that changing? Because I think that's one of the biggest obstacles why doctors are not are reluctant to taking in this new data basically from patients.
This is true, and when you are doing these things, you really need key opinion leaders on this. Who are the doctors who are supporting the idea and saying that this can really fly. You need a lot of clinical data, of course, and for that you need doctors, because otherwise you do not get that. So I must say that I would like to see doctors to be closer involved in the development of these things, but the problem is how to get them in. So maybe some support. I remember in the past we used the Helsinki University Hospital Lab as a reference in many cases. They were very positive for new innovations, and they took the risk by taking the instruments into the laboratories, testing the instruments and so on. So it worked pretty well, and I don't know if that's happening anymore, because these private clinics and so they do not really do this kind of work. They cannot afford. Helsinki University Hospital, they can afford to make this kind of experiments also. And it's the biggest hospital anyway in Finland. It's covering almost half of the population. And they are playing very important role on these procedures. So, but I'm not a good doctor to say how to make this.
Yeah, but don't you see that? Do you think that doctors are afraid of losing their controlling role, and they are opposing that a little bit?
Yeah, this is really true. Like this carpal tunnel syndrome. Our biggest enemy is a neurophysiologist who believes that he is losing his business because nurses are doing this. Yeah. So in that way, you have to swim to the same direction with the doctor. So you have to make it in the way that, if you start to use this, you save this time for something which is much more important for you. And this is how it works. Otherwise, they are against you, and when they are against you, you never get this through. They are saying it's not working. And they are anyway the ones who are sitting and deciding the reimbursements and all the stuff. So you really have to swim to the same direction with these doctors. I have seen same when you bring glaucoma measurement to optics. The doctors are again against that, because they should be the ones who are doing this. But if you make a tool how they also can make money with this, then it works. And this is how it should fly.
So it's more like personal contacts, more communication and so.
Yeah. And make the case for them, not tricky. Against them.
Okay. Any other questions? Yes, please. One moment. We need the microphone. Where is that? Oh, here was a question first. Okay, we'll take here and then you we'll take from you.
Tom Schmidt from Riga. Actually, you stole my thunder because I had already made a note to myself that really the argument is for the doctors is maybe a small reimbursement for looking at the test, but really what it does is it frees up space to see somebody else. Because I think of my family doctor and all of us waiting in line, and if half of us didn't have to be there, the doctor would be able to see 2 times more people who, you know, and get the reimbursement for that.
Yeah.
And I mean, to me, the biggest model for any of this is just big pharma. I mean, just the way they have fingers into every place, and they have their so-called detail men every place who are making the argument day after day, and there's no escaping it, essentially, if you're a doctor.
Yeah. They have to be able to make money. That's the key.
Yeah. Even though I still have to say that regulations are quite against it, because even if a doctor is willing to use and willing to take money, then the regulation usually says that this is not what the doctor gets paid for, and that's why it's very, very difficult. I think that's one of the biggest reasons why in European-wide it's been so difficult to implement.
This is why I said that we have to change the regulatory system.
Yeah, absolutely.
Yeah, that's very important.
Okay, and now from a doctor, I think.
Yes, I'm a doctor.
Okay.
My name is Eero Meriland. I'm working as a GP, and I'm representing Estonian Health Foundation. Just to speak about this payment, we have started in Estonia the new payment system, and it's called e-consultation. And the doctors who want to participate in e-consultation, they will pay for this e-consultation. And I think it's the big change in Estonian healthcare also. And as a doctor, I say we are not against the point of care testing. We are against the answers or how the patient understand them. When they understand it correctly, we are very happy. It makes our business a little bit easier.
Yeah. But this is why I'm saying that the networks and using the doctors to give the diagnosis, it's the key how to find a solution for this. I know Estonia has been very strong on this e-health side. Even the Finns, they are stealing your people. So on that. But Citra just took somebody from here. So I think in Estonia it should be easier, much easier than in Finland to build up something on this. You are a small country, and you are a very dynamic country if I compare to Finland. So it's a good opportunity here. And you are big enough to be a good model for the rest of the world.
Okay, one more question. Do you see? But then I would like to ask a kind of $1 million easy question: that what's the next big thing in point of care?
Next,
so what next big thing? What should I go and invest into now after this seminar? Small tip, you know.
Can I give names of my companies?
Maybe let's say in 10 years' time, what do you think where it's going to end up?
It's one which is coming in a certain period is molecular diagnostics and point of care combination. When that's on the market, it's a big thing. So I do not know the companies yet, but
no. We will make them happen. Yeah. We will start them today. So, okay, thank you. It's an excellent answer, and let me thank you by giving you a small innovation from Estonia. If you know that IT is moving into everywhere, also in healthcare, but now it seems that it's moving into plants as well. And it's especially good for your kind of person who travels a lot and has less time to take care of a plant. So there's an IT part that takes care of a plant. You just have to water it that once, and then it will grow on on its own. So thank you very much for your presentation. Let's give a big hand.
Thank you. Thank you.